So if you have a team with one RN and 5 patients in a perfect world, and possibly one nurse assistant to work in that team, the whole of healthcare would, certainly in facilities, institutions, hospitals particularly, would change for the better, because now you would have 2 sets of eyes on those patients. You would have the nurse being able to do her nurse specific tasks, and you would have the nurse assistant doing their nurse assistant specific tasks. And the nurse, for example, and I know we mentioned it, in a perfect environment, and I know there are plenty of states of nurses probably listening now who say, oh gosh, 1 to 5, we dream of that. But in a perfect situation, and we had 1 to 5, and we had that nurse working with the nurse assistant. They say there was an emergency, or there was something that the nurse needed to do immediately. They could go ahead and do it. They could have eyes on the patient. They wouldn't be giving 12 minutes of every hour to a patient for non-nurse specific roles, because that's what patients get. If you look at 1 hour with a nurse who has 5 patients, 12 minutes. 12 minutes. Now, that's not the time the nurse is in the room teaching the patient, checking in with the patient, talking about goals of care. That's the time the nurse has to be in the computer looking for orders, results, etc., etc. But if you had a nurse assistant there in the room, then that would free up that nurse to be able to do her specific tasks or his specific tasks.